Arthritis. She is 1 year 3 months and she has got both the sides severe hip dysplasia. We are planning FHO surgery. So the landmark is, this is her greater trochanter. You can just feel this. I can feel it. We are giving a curvilinear incision here. Normally I don't put the betadine bandage, this wrap, but in this case she is having some skin issue and there are some lesions are there on the skin, so we are using this betadine sheet to avoid any infection. And most common complication of in this case is only the infection, that for me it's approximately 2 to 3% coming. Apart from that, these surgeries doesn't have any complication at all. I have 1 or 2 dogs out of my like 800 dogs which we have done this surgery. That was we have got one fracture in greater trochanter, and that happened twice with me. One with my colleague and once with me. It has happened twice, and then we have to and that was unusual because it has happened after I have finished my almost 700 cases. After that only this complication has come. So very unusual complication in that dog. That dog was very old. His whole neck was having lots of osteoarthritic changes. So probably somewhere we have missed the anatomy. We have gone a little more deeper to see the neck, and I got the problem, but that was not a condition where I struggled too much. We managed that case well with the pinning and one tension wire. So here we have removed this is the biceps femoris muscle, and this is the tensor fascia lata. We have removed the layer, and now this is the superficial gluteal muscle with the fascia. So I am going to just cut the fascia here, and you can see the fascia I have cut completely. The muscle also is little towards a little longer area, and can you see the muscle? The belly is in different shapes. So one part of the superficial gluteal muscle I am just cutting, and plus the fascia only I am cutting. And as soon as I cut this, I am able to visualize the vastus lateralis muscle. So this is the fascia of the superficial gluteal muscle. This is vastus lateralis biceps femoris muscle, and the upper area, this tissue is tensor fascia lata. Okay, so now immediately after that we will able to see our deep gluteal and superficial the medial gluteal muscle. So here this tendon is of deep gluteal muscle, and in between superficial and so this is superficial muscle. In between this area, this is the middle gluteal muscle. Can you see the belly here? And below that, below this is the deep gluteal muscle. So superficial, middle, deep gluteal muscle, and this is vastus lateralis. Okay. Now next step what I do is I try to go a little more deeper. This dog is having good muscle, plus this dog is having lots of fat also. This ideal weight for this dog should not be more than 28. This dog is 33 kg, so probably 4 to 5 kg extra weight is this dog is carrying. Look. Can you hold this? So here these are the blood vessels which gives supply to the joint and the capsule, and those are I am just cauterizing, because sometimes as soon as you touch this area it bleeds. So I am just cauterizing this. I am able to feel my capsule and femoral head here. I'm not sure whether you are able to see it, so I'm just going to start cutting my capsule here. We'll just see this one joint fluid is going to come here. I think because of dryness, hardly any joint fluid is left in this dog, even though this dog is very young. Being this is a bigger dog, in smaller dogs sometimes all these structures are very superficial, so you are able to see better. I think now the fluid is coming out little bit. Can you slightly loosen it? Fluid may come out. Yeah. Now fluid is coming out. Yeah. And I'm just cutting some part of the vastus lateralis muscle with the capsule to release the neck area for my cutting, so that I can visualize at the time of ostectomy. I can visualize it nicely. So I separated this area. Now I'm going to put my Homan here. And I'm going to put this scoop this dog round ligament is already broken, so there's no round ligament left here. So you can see that neck I exposed completely from this side. Sometime if it's a very old dog, sometime we need to just remove some of the osteophytes from here. His hand is coming in front, or you're able to see that? I'm just separating this whole, trying to separate this whole capsule with my cautery. If we have removed this whole, we remove this all attachment before, we don't struggle while removing this head of the femur. Sometimes it takes a little time to remove the head of the femur even after cutting also. So I'm just trying to remove everything before only. So this is the head completely. I'm using the oscillating saw blade. Whether he need your help somewhere. So I'm making a little, you can see the position, because we can't bring this more than this. The position is like this. So we have almost cut this, and let me see whether I can separate it. Once you separate it with the, you need to hold this with a reduction forceps and try to remove these attachments with the scissor or with the cautery. So in old dog, this is little problematic situation. Sometimes it takes little time to remove the head, because there's lots of and being in these cases, the fibrous tissue is very thick. It doesn't come so easily. Sometimes little bit of medial side capsule also comes, which also keep holding, or at the lesser curvature the source muscle is there, sometimes that also doesn't allow it to, can you hold this stuff, to come so easily. In young dog there won't be any these adhesions, and also in young dog usually we get very easily, this can come very easily, but in old dog always it takes little time. It's not a struggle, but definitely it takes little extra time to release the whole thing. So you can see for a young dog how much damage is happened to this one. The round ligament was broken already long back, and there's lots of arthritic changes. Can you see how much angle we need to give to remove these all the extra bone formation here? If you don't remove, these are secretory tissue. Any tissue which is secretory, if you don't remove, there is a pain can stay later also. Some part of the lesser trochanter also has come, so some part of the muscle I removed from here, but it looks good to me. It's looking fine. So now just we are going to suture our capsule. There's hardly any bleeders are there. I'm using 10 suture material, which is non-absorbable proline, for suturing the capsule. Usually I put 1 or 2 stitches on the capsule to give a protection to avoid bone to bone contact. So I am not sure whether you are able to see or not. but it is always difficult to see this deep because it's quite deep actually. And this particular dog is because he is having high muscle, big good muscles. Um, this dog too much muscle, very high muscle. In these, when I are doing suturing, these needles should be small in size because it has to turn. Um, Without turning, you can't do this kind of suturing. And the capsule is quite thick actually. It's a very thick capsule. What I am getting. Okay. So difficult to see with this. To see, this is one I have taken. Can you just hold up? One suture we have taken, and before tying it, we are taking other suture. We are going to cut this, and then we are going to take another bite, and then together I am going to put the note for this. You can see this very thick capsule if you are able to see. I am taking bites from this very thick capsule. So now I am just going to make suture. I am putting this slip knot. Suture material, PDS. So now we can just see that there is a very big capsule is there under the muscle, under the bone, and now we are just going to release these, and we are going to start doing our suturing. For suturing also I will explain it, because we haven't cut any deep gluteal muscle. Some people they cut the tendon of deep gluteal muscle. Once I release, you can see that all the muscles have come back. There is no gap left in this. So I usually try to avoid cutting any of the muscle except vasa lateralis. This muscle I cut little bit, and some part of it, and this I try to suture over the one suture to the deep middle gluteal muscle. You can see I have taken this bite to this middle gluteal muscle to close this area completely, and rest of the muscle I am going to suture with itself only and with the greater trochanter area. Hardly in this whole surgery any bleeding has happened. Sometime you may deal with the bleeding, but it's not always very bad bleeding and all you can control. Sometimes from the capsule also bleeding keep happening, which we need to just tackle it. So you can see now that area, whole area been closed nicely. Suturing also as important as the cutting the muscle, so that we suture in such a way that these muscles keep working as usual. They should not change their position and all. So, and we try to minimize changing the any orientation of the muscles. So now this is the inner part we have done now. Now I'll explain the next step. Next step is to suture the superficial gluteal muscle, which we have opened. We have cut little bit, and then the fascia of superficial gluteal muscle. We are going to give our local anesthetic also. So this is the fascia of the superficial gluteal muscle. I am holding the fascia of superficial gluteal muscle, and just from other side also I am taking. Cut also. We will just give local anesthetic in these muscles. And every time I need to hold this fascia and take the bite. Hold this fascia. You can see this fascia got stretched now. And this side, can you see the muscle and fascia? Some part of the muscle I cut, this belly of muscle I cut. So I am just suturing opposite to that again. You can see the other side muscle belly is coming here. Some part I have stretched it. Now you can handle. The next layer will be this is the biceps femoris biceps muscle, and this is the tensor fascial lata. I am just suturing these two structures now. What's happening? That's okay. What's happening? I'll go doctor. I'll come 1 minute. So this is the next layer we are putting, where we are taking the fascia of the biceps muscle and suturing with the tensor fascial lata. Little bit bite, and sometimes there will be a gap formation in this area, and some seroma formation happens, especially when I am doing this surgery both the sides. And this dog, we are doing the surgery both the sides in same sitting only. So immediately after this surgery, we are going to start the other surgery also. So in these cases, I try to minimize the dead space in these cases, and next layer will be only subcut and skin layer, so that we are not doing anything for that. I mean, we are not doing the videography. In terms of postoperative care, this dog is staying with us for 5 days. We do intensive care for them to give them physiotherapy, so that within 3 to 5 days they can start walking. We do lots of wound care, because when the wound is both the side, we have problem of getting some infections, especially if they have already some skin infection. That is when we have more issue with the skin skin infection. So this dog will be on a fentanyl patch. Fentanyl patch will be there, and the basic other medications. One antibiotic we are going to give for this dog particularly because of the infection, and that's all about the FHO surgery. Thank you.